This is Jessica DaMassa with WTF Health. I am here at the Bayer G4A Accelerator launch in New York City, and joining me is the ever fabulous Dr. Rasu Shrestha. He is the Chief Innovation Officer at UPMC and also the Executive Vice President for UPMC Enterprises.
That's right.
So talk to me a little bit about consumer health. This is something that we haven't had a chance to really discuss. And so what is consumer health looking like to an enterprise like UPMC, a big hospital system?
So what's really interesting, Jess, is healthcare doesn't quite get consumers. And consumers, they don't get healthcare, right? It's this mess of confusion and complexity and, this innuendo of mazes that you need to navigate at what is perhaps the most critical and vulnerable times of your lives, right? Or the lives of your loved ones. And that really is the definition of how consumers look at healthcare today.
Right.
However, what we're trying to do from a health system perspective is to really say, all right, what does the new world of consumerization of healthcare really look like? How do we make sure that this is not just about those critical moments, those vulnerable moments when the patient comes in as a patient and has to navigate the mazes of healthcare, the complexities of healthcare, but where, in this new world, consumerism and their embrace of healthcare really becomes more pervasive. This is about us saying, look, healthcare shouldn't just be limited to the bricks and mortar hospitals as we've known for it to be for centuries at a time, but really healthcare should happen where consumers eat, work, live, and play. It should move well beyond the bricks and mortar hospital walls to really their smartphones, their pockets, their devices, and speak to the essence of how they should not just survive from an illness, but really thrive, right? Being pervasive and making sure that they're not just engaged, but empowered and giving them the right set of capabilities and tools. That's what the new era of consumerism in healthcare looks like from a health system perspective.
How do you feel like this is unfolding? Are we at is this nascent? Like we are in like the early days of this consumer health movement? Are we moving along faster than we think? Or what is your assessment of the maturity level, I guess, of this consumer health movement that we're in?
So I think there is an abject realization that we need to really embrace the consumers and make sure that we're able to move them to a point where they're part of the decision-making matrix, right? So we're not providing care to them, we're providing care with them as part of the team. Right? Having said that, I think we're at a fairly early stage in our true embrace and understanding of what consumerization of healthcare really means. Today, in large parts, it's really about building apps and uploading it to the App Store and making sure that the consumers download those apps and they may or may not utilize them and all of that. And that's important. I'm not downplaying the need for these apps because that's essentially how you get to them. But there's so many other caveats that really need to be addressed head on for us to make this sticky, for us to make this into the newer business models that'll redefine the future of healthcare.
Like what?
So as a payer and a provider system, right, part of what we're looking at is not just how do we build these apps that the consumers will download into their smartphones, but how do we make sure that it's able to change behavior, it's able to influence the behavior of the consumers. And for us, how do we make sure that we're able to bridge the consumer's world of where they have the devices and they have the apps to the world that clinicians live in, which is really the EMR, the electronic medical record system. So we've invested in companies like Xealth Health that really bridges the divide and says, hey, look, much like how we're prescribing medications through our electronic medical record system to the patient, and the patient then goes and picks up the script and the medication, we're able to now prescribe apps directly to the patient and create a bidirectional interface directly between our world, the clinician's world, which is the electronic medical record system, and the patient's world, which is really these apps and the smartphones. But for the first time, that conversation, that language, that commonality, that bridge is actually being built, right? So that's one way. The other really is in terms of business models and incentives.
I was going to ask you if you didn't go yourself, so I'm glad you walked over. Hi.
So I think that's really important because it's not just about prescribing these apps and making sure that they download them and then we have the data flow back and forth. That's really, really important. But how do we make sure that this newer business model of where if our hospital beds are empty, right, we're still profitable. We're still doing the right things for that consumer, for that patient, for that person. And that's the approach that we're taking as a payer and a provider system, is not just looking at these consumers as patients, but really looking at them as people, as persons. So it's a person-centered approach to care. And that's how we're incentivizing our business models. What we're saying is, look, if that patient, that consumer, falls ill, and we're human beings and it happens, right? We provide them the most excellent care, the most life-changing medicine, which is our tagline, to that person, to that patient. But we get them well and then send them back home where they eat, work, live, and play. And we want them in that circle of wellness. We want them thriving in that circle of wellness, because then that business model for us as an integrated delivery financial system actually makes sense. Because that's when the outcomes start going up. That's when the costs start going down, right? That's when the quality of care and the patient satisfaction rates actually start going up. So that's really the new business model that we're trying to push forward with.
I want to ask real specifically, because you had mentioned it, part of being a consumer is when you have control over your dollar. And in a lot of cases within the health system broadly, maybe not exactly UPMC, but there is a layer of an insurance company or something that's dividing you as the consumer and where you're getting your care from. Sure. So how do we mitigate that, I guess, as an industry? Like, what is your take on how we really reach the consumer when the consumer and their dollar are separated?
So what's really interesting, Jess, is this transformation that we're undergoing in the industry today, where risk is shifting. Yeah. Right? Risk that was traditionally borne primarily by insurers is moving over to the providers. And very quickly, it's also moving over to the consumers, right? So we're bearing the brunt of a lot of the expenses. We're controlling our purse strings. We have more awareness of our copays and deductibles than we've ever had before, right? So risk is shifting. And I think the New World Order really is about intelligently managing that risk. And also, from a consumer's perspective, it's being able to build tighter alliances, not just with your provider organization, but with your insurance company. And that sounds a little strange because insurance companies don't really directly interact with patients per se, but the right ones do, right? The right ones are engaging their consumers in a way that they've just never done before, where we're able to really manage and mitigate these risks, the shifting in risk that I talked about earlier, and where we're able to look at not just clinical data from an insurance perspective, but claims data, patient preferences, right? Consumers' data in terms of where they eat, work, live, and play, their zip code data, all sorts of other data elements that are being pulled together to really affect behavior change on behalf of those consumers. So that really is sort of where we're going.
All right. How much is the consumer ownership of their own health data going to influence the way the consumer health market continues to take shape over the next few years?
So I know that's been a war cry amongst many of us that are passionate and really free the data, right? And really enable these consumers to take charge of their data. And while I believe that vehemently, I think that's really, really important, I think that's not the end goal. The end goal really is not just freeing the data and giving the data back to the patient who rightly, really owns the data, but empowering the patient, empowering the consumer to take charge of their health and well-being and do something with that data, right? How do you make it actionable? How do you make sure that they're able to understand what that data really means? They have no clue, right? How do you provide them guidance to move towards the right decisions that they need to be making? How do you give them the choice? How do you make sure that they're able to participate in those decisions, not singularly and on their own, but really collaboratively, right? So this new world really looks like this participatory care environment, right? So we're shifting from an era of paternalistic medicine, which is where we've been for centuries at a time, not just in the last 20, 30 years, to this new era of participatory medicine, right? And that's where I think the right models are really starting to come together, is the patient, the consumer, becomes part of that care team. And we're able to articulate the specifics of not just what medications work for me and what surgical procedure I prefer to take versus something else, but also what my preferences are, what my life goals are, what my motivations and drivers are, what my economic status is, what I can afford to do versus not, what my Absolutely, and that really is the new focus that we're trying to bring together.
Okay, put on your UPMC Enterprises hat for me and tell me from a consumer health standpoint there, what types of startups are you guys looking for? What types of solutions are catching your eye from the old UPMC perspective?
So we're really trying to take a very pragmatic approach to the consumerization of healthcare, and we're saying, hey, look, the new day of everything that I described in terms of consumerization of healthcare is dawning. It is here. As a payer-provider system, we're a couple of years ahead of the rest of the marketplace. And what we're really trying to do is focus in on specific areas where we can make that dream a reality, right? We're focusing in on areas like mental health, for example, right? How do we make sure that we're able to specifically address some of the most critical barriers to getting access to mental health resources? So today, stigma and access to expert mental health resources is, those are real problems, real barriers. So part of what we're trying to do at UPMC Enterprises is work towards directly addressing both of those barriers. We invested in a company called Lantern Health, and we're co-creating a set of solutions with Lantern where we're embracing the reality of mobile devices and tablets as a way to get directly at the consumers, where we can algorithmize these CBD protocols and get them directly to the hands of these consumers so that they don't have to necessarily walk the hall of shame and see a shrink and get and so they can have direct access to expert mental health and behavioral health resources directly from their mobile devices. They can get expert coaching directly from these devices, and they can get access to human beings and psychiatrists and others directly in our facilities if and when they need it. So that's one aspect of how we're trying to really address this notion of the consumerization of healthcare.
Okay. Last question for you.
Yeah.
Real quick, what are you most looking forward to in terms of the consumerization of health? Like within the next couple of years, what are you really looking forward to?
So how do we go from where it is today, which is more of I don't want to quite put it this way, but in large parts we're paying lip service to the consumerization of healthcare. It is not, right? So there's a big difference between downloading Angry Birds on your smartphone and downloading a health app, right? It's more than just going and achieving levels and moving to the next level up, right? There's more to it than that. Yeah. It's really putting in all of the context of everything that I talked about, making sure that you're building into it the right incentive models, that data is actually flowing freely back and forth between your care providers, the care team, and you, the consumer.
And you understand what it is. You understand what your data means.
Absolutely, right? So there's some element of gamification in all of this, but it is so different. It is so complex. So what I'd love to do is over the next couple of years for us to see in the industry this embrace of what it truly means to get the consumer in terms of their healthcare and their journey. And I'd love to see this proliferate from sort of this era of let's create apps and upload it to the cloud and to the app store to where we're making it sticky, where we're empowering the consumer, we're taking charge of their health. They're able to really be a participant in their care journey, and we're able to incentivize them towards the right types of behaviors with the shifting in these business models that we talked about.
Rasu, thank you so much. It's always a pleasure to talk to you and get your perspective on basically anything when it comes to healthcare. So thank you so much for stopping by. This is Jessica DaMassa with WTF Health. Thanks so much for joining us.